Hi, again, we're going to do the sequence of comprehensive physical examination. I had to cut the video because it was a bit too long, 7, so I'm going to send it in various parts until we finish up this so that it's easier to upload because that's been one of my problems. I did a really long one and I've been unable to upload it. So, by sequence, we have him, the patient John, in a sitting up position, right? I'm looking at him for his appearance, his level of comfort or distress. I'm looking for orientation. I'm looking at his height and his weight, putting it into consideration. I'm taking note of it, the temperature and blood pressure, heart rate, respiratory rate, oxygen saturation, so on and so forth. So narration example. I begin with a general survey, observing the patient's overall appearance, level of consciousness, posture, hygiene, and signs of distress. Okay. Now, next, I assess the head and the patient's neck, including his eyes. So his eyes are closed now. Ears, overall, his oral cavity, and lymph nodes, depends on where we're checking for, his thyroid glands, and why the patient remains seated, right? Now the thorax and the lungs. In a sitting position, you are inspect, I'm going to take off this right now, and inspect his chest. As I look at his chest, I'm checking for the expansion, up and down movements, expansion and closure of his chest. I'm trying to palpate to see whether it's symmetrical in appearance. I'm trying to percuss the long fields. And I would try and auscultate. I have this. And auscultate his long fields at multiple locations, listening for any kind of breath sounds that are not healthy. Now, I also take the lungs, comparing both sides of the chest to assess for normal breath sounds, such as vesicular sounds, and to identify any abnormal sounds like wheezes or crackles. Now, we're going to move up to the what? Cardiovascular examination. Now the patient I'm going to put the patient in a supine position. Hey, John, I'm going to help you lie down, okay? There you go. I hope you're comfortable. Let me know if you feel any kind of discomfort, okay? All right. So, he's now in a supine position, right? With the head elevated to about 30 to 45 degrees. And I'm going to inspect the jugular veins for distension on both sides of the right sides of the mid neck. And then I'm going to palpate the point of maximal intensity. That's on the 5th intercostal space. On the left hand side of the chest. Right here. Then I'm going to auscultate for heart sounds at the 5 points. At the aortic, the pulmonic, the tricuspid, and the mitral valve location. No. Now I'm going to auscultate. I auscultated the heart using both diaphragm and bell of the stethoscope to access heart sounds, including S1 and S2, and to identify any murmurs. Now for abdominal examination, I'm going to see how I can do. Now I'm going to keep and leave the patient in the supine location, okay? Sequence is different from other exams. I'm going to inspect, auscultate, percourse, and then palpate. By assessing abdominal, you access, okay, in this case, because I'm going to check for the abdominal contours. We're going to listen for bowel sounds, organ enlargement, tenderness, or masses. So the stomach looks okay. There's no abnormal contour. You assess for bowel sounds in the 4 quadrants of the stomach. The upper right, and lower right, upper left, and lower left quadrants. It's not fast like that, but for the purpose of a demonstration, I was hoping that I can let you know. I'm checking for tenderness to make sure that there's nothing painful and that there's no organ that is enlarged. By doing that, and then checking for masses also, I begin with inspection of the abdomen, followed by auscultation of bowel sounds, precaution, listening to abnormal sounds, and palpating. And that will do for the abdominal examination. So I'm going to end this one and then continue with the next segment, which is the musculoskeletal examination. Thank you.